I'm doing a video narration of this result of an injectable rhinoplasty for this patient. This is a patient that I had really wanted to do a revision rhinoplasty on, surgically speaking, and she just did not want to have it done. So I was left really with no recourse other than an injectable rhinoplasty to improve the situation. What really bothered me when I was working with her in terms of making her face look better was the absolutely unnatural appearance of her nose. It really compromised my ability to make her look better as a human being. Therefore, I really encouraged her to the point of maybe annoyance that I wanted to make this nose better, because I felt that just making her look more youthful with an unnatural nose was something that was very troubling to me. I think I sometimes bother my patients quite a bit, and it's the artistic side within me that does not let go something that doesn't look right. And sometimes, which I believe is, a lot of patients actually cannot see when something doesn't look right, and it's my job to tell them something looks wrong. I've had a patient where her lips just look way overinflated, and it really bothered my soul. And I probably mentioned enough times that she no longer became my patient until an interesting story. She was in the green room with some of her friends, in other words, being before a TV production, and they told her, hey, you should be going to see Dr. Lamb. And she said, as everyone said, well, she was, until she went somewhere else to get other things done. So for me, my passion is making people look natural. Now, with an injectable rhinoplasty, it is very important to understand the limitations of ability to correct the nasal tip. The bridge, you can raise the bridge relatively easily because the skin tissue is relatively elastic, but the nasal tip is not easy to improve. In her case, I really got lucky. One of the most important things with injectable rhinoplasty is to understand the potential for problems. When you use non-cannula-based injections, in other words, with a needle, and especially in a patient that's already had a rhinoplasty, there is a risk that you can have necrosis and problems, especially in the nasal tip and especially after previous rhinoplasties. So this was done all with hyaluronic acid, something reversible but very long lasting, and in my opinion this nose will last her many years, minus maybe a few minor corrections, and I've actually seen this. The nose has lasted about a year so far with almost no corrections. And the key thing too is when you look at her nose on the before, it looks very asymmetric. Now, if you look at her on the after, there is still asymmetry. But the one thing that I want to point out is, even though there's asymmetry, it doesn't jar your brain. We're all asymmetric, and it's impossible to get something perfectly symmetric. But if I can make it at least the point where things look in harmony and balance, and the symmetry is mitigated to the point where your brain doesn't see it as a deformity, I think we've gotten quite far. So that contracted nasal tip was all done with cannula-based injections using hyaluronic acid, which, as I mentioned before in this video, I think it's going to last quite a bit of time for her, if not even indefinitely. I found that once you inject hyaluronic acid-based products, they can last years, if not indefinitely, after a few rounds of treatment.